everyone. I am Dr. Giovanni Spinner. I am the CEO and founder of Beacon Public Health. Tonight, we're going to be talking about the role that doulas and midwives play in improving birthing outcomes, especially for Black, Indigenous, and people of color. Before we jump into some background and housekeeping rules, I do want to do a round robin with a quick introduction of our speakers tonight. So if you all could tell us your name, if you're a doula or a midwife, and where you work, and then we'll be able to jump into the conversation. So I will start with Kayla.
Hi, everyone. My name is Kayla Harley. I'm the founder of the Beachbody Marketplace. I'm a certified optimal breathologist and full spectrum doula. I am from the Washington, D.C. area, and I'm happy to be here.
Thank you. Next, I'll turn it over to Lauren.
Hi, good evening, everybody. My name is Lauren Adjucum-Damptey. I'm a certified nurse midwife and women's health nurse practitioner. I work in Northern Virginia currently at a community health clinic. I'm also the owner of a perinatal education platform called Birthing with Confidence. And I'm also happy to be here, and hopefully we can give you guys some good information.
Awesome, thank you. And next, William.
Good afternoon, everybody. Thanks for being here with us today. I'm William Moore. I'm a doula and lactation educator, as well as a race and health equity administrator for Ramsey County in Minnesota.
Thank you. And last but not least, Pansy.
Greetings, everyone. I'm so happy to be here. And I am a doula, a childbirth educator, also a doula trainer with the Birthwell doula training organization, also the founder and owner of the Sacred Paws Red Room in Reisterstown, Maryland. So happy to be here.
Awesome. Well, thank you to all of our panelists for being here. I know you're all going to share some amazing insights on the role that you all play in maternal health. I do want to provide a little bit of background before we get started and a few housekeeping rules as well. So I definitely want to encourage everyone to participate in the conversation by using the Q&A function. Please ask your questions and we'll make sure to get them answered. And I'm sorry, I need to pause because I forgot to introduce our moderator for tonight. So Diana, please introduce yourself.
Hello, everyone. My name is Diana. I actually work as a public health analyst for a local health department, but I've been with Beacon Health, and I'm excited to launch this campaign.
Awesome. Thank you. And so I want to give you a little bit of background about Beacon Public Health and why we are doing this type of work. So I founded Beacon Public Health a couple of years ago, and really the vision is to diminish the impact of chronic diseases among Black, Indigenous, and people of color. And really what we want to focus in on is the prevention, treatment, and management of chronic diseases. And so this particular topic is very near and dear to my heart, which is why I wanted to make sure that we had some dedicated resources that are culturally tailored for our communities that were developed by us and for us. Also, really excited to say that this is just the first offering of our maternal health campaign, which we'll be launching later on this week. And so we'll be sharing information about that as well. For anyone who is a certified health education specialist, I want to say we will be offering 1.5 hours of CE credits. You will have to complete the evaluation, but we'll put that in the link to make sure you are awarded your credits. So with that, I want to jump into the conversation and have an opportunity for each of our panelists to give us a little bit more detail about your work and how you got involved in maternal health as a doula or a midwife.
So I'll start. So doula care really found me. I found myself at a point where my friends were having babies and some of them just didn't have the support that they needed. It could have been boyfriends or partners who weren't around consistently, or maybe there were wives who had military husbands, and I just felt compelled to be there. I've always loved children, and I realized that moms were sort of in a frenzy, and it started out with just me coming by, checking on them, to me really diving into this work, and then ultimately I became certified.
Awesome, thank you. Lauren, how did you get started in your work?
Yeah, I think kind of piggybacking off of that, I also feel like I was just kind of called to this work. I always knew since I was young I wanted to do healthcare. And as I went into my undergraduate studies, I went into nursing and just fell in love with women's health. And I met a midwife who opened my eyes to midwifery. And just as I learned more about the issues in women's health, both within the US and internationally, my family's originally from Ghana. So also just paralleling the experiences of women in Africa, the experiences of people in the United States, is just what I felt called to do. And I went on to become a nurse and then transitioned to midwifery. And I've been very happy.
Awesome. And William, how did you get started?
Yeah, so I got started through working with a local group here in the Twin Cities called BEC, the Birth Equity Community Council. And what the Birth Equity Community Council does is try to address disparities in the infant mortality rate and the maternal death rate in creative ways by really kind of getting together and, as I would say, like crowdsourcing information from community, direct care service providers, public health nurses, so on and so forth. And what happened was, and what BEC does is, they meet every other month, and like I said, try to come up with these creative initiatives to address these disparities. In one of the meetings, a lot of community members and moms were expressing the need for more parenting resources and help for their partners. So one of the public health nurses there, by the name of Ms. Tamiko Rawson, came up with the idea to train men become doulas and lactation educators. And the purpose of this is not only to give men more courage to kind of step up and be more supportive of their partners when engaged with the healthcare system, but also to be informational resources to other men in the community. And so when they're looking for men who would volunteer to kind of take part in this, because even though this was a cool new initiative, obviously it's not something that typically men clamor to be a part of, I actually just volunteered to do so. I looked at it as initially as just a creative way to really give back and help my community. But as I started learning about the history of birth work to Black and Brown people and how that it wasn't just let's just say a resource that was made accessible for middle class or wealthier white families, but this is in fact something that was culturally important to Black and Brown people as well, especially African Americans. When we came here from the continent and were enslaved, it started to feel more like a cultural responsibility instead of just a way to give back. So that's how I got my start.
Thank you for sharing. And last but not least, Kenzie.
Yes, like so many of us, I was called, especially at a young age, being very drawn to mothers and babies, nurturing and taking care of the, elderly people or sickly people in my family. But moving forward, my own experiences of, pregnancy and losses, and also a young girl growing up without her mother, noticing how that played a major part in my own experiences of pregnancy and birth. And that led me into just looking at the traumas that so many of us face, with our Black and Brown sisters, and how it just feeds in and it impacts, right, the spiritual transformational experience of our pregnancies and births. Moving into that, I did meet Elijah Brown in Baltimore, that of the Birthwell, who suggested that, I become a doula. And so many people after that, oh, can you be my doula? So I did not see it in myself for a very long time. Not too far after that, I did accept the position as a birth assistant to African-American lay midwife, where I worked with her for about 6 years or so. And I started my own studies of midwifery and went on to open the Sacred Paws Red Room, a sacred space for our sisters to be able to have safe space for us to, nurture our spirits, our minds, our hearts. And it has made an amazing transition in the births experiences in Baltimore and Maryland and DC.
Thank you for sharing. And I do want to pause for just a second to give a shout out to Kayla for figuring out the video issue. So thank you so much. You have relieved a ton of stress on my side. Just to get back into the conversation, I did definitely want to thank you for figuring out that technical issue for us. So we know that over 60% of the maternal deaths in the US are totally preventable. What are some of the other pressing issues that are facing Black, Indigenous, and people of color as they are, getting pregnant and, thinking about their birthing journey and how to deliver their baby? So what are some of the other issues that you all are seeing? in the community?
I think for me, something I notice a lot of multiple things. I think access to care is definitely a big issue in a lot of areas. A lot of places just not having enough resources for people, enough resources of if you want to give birth in a different setting outside of the hospital, even if you want to give birth in a hospital, there's a lot of places where just having adequate access to that is not there. Having adequate staff or having adequate healthcare providers in those areas. So we kind of talk like about maternity deserts or areas where people just don't have the resources that they need. And I think for me, something else I've really see is that many times the healthcare system traditionally is not built to really, I feel like, get people truly prepared for their pregnancy, for their labor and birth experience, for their postpartum experience. I personally have seen a patient in the hospital getting ready for their birth, and some of the questions they're asking me, it's like, oh my goodness, like, how did we go your whole pregnancy? And there's so many of these questions that you don't know the answer to. You should already know this, which is why I'm such an advocate for childbirth education and taking those time with our prenatal course to really get people more educated and prepared. But the traditional healthcare system is just not built to really build that time in a lot of
Yes.
people with prenatal visits.
So you mentioned giving birth in the hospital. So for the folks online, are you able to have a doula or a midwife if you decide to have your birth in a hospital?
Yeah, so most midwives, well, most nurse, I'm currently a certified nurse midwife. There are different midwives. Most nurse midwives typically actually do work in hospitals. So a lot of states, yes, a lot of nurse midwives do work in hospitals and then as well as birthing center and home birth settings as well. And your hospital, if it does not allow a doula, that is very problematic. I personally have not worked at a hospital that does not allow doulas. I do think some hospitals can kind of gatekeep a little bit where they make a lot of special certifications have to be had by certain doulas, which I think is just another obstacle. But many times, I personally love when I'm at the hospital and my patient has me, they have their doula, we have our backup physician if we need it type of setting.
Awesome. Pansy, and then I'll go to William.
Yes. I find that with the hospital setting and our practitioners, that they have a hard time separating their belief of birth, right? Pregnancy, birth, and postpartum, and separating that this is the patient's, the mom's, the family, very unique experience. It's theirs. And with that, they don't offer all of the options, right? It's kind of black and white cookie cutter, which is not fair, to us. So if you don't walk into that setting educated and prepared, you're not getting all the information for you to make informed decisions, even when it comes to risk and benefits, with different interventions. They're not giving you all of the information. And when it comes to the health of the mom and the health of the baby, how can we make clear, good, excellent decisions with just a little bit of information? So yes, that's our biggest obstacle. You have to have a doula and have childbirth education to walk into these hospitals.
Thank you. William, did you have
Mhm.
something to add to that?
Yeah, so I'll talk about it in terms of there's 3 to 4 different things, and I mentioned them all. I'm going to mention them all together instead of saying like one is the largest because they all kind of play off of each other. So one actually I think is simply like the education about it. There's still a lot of brothers and sisters out in our community that actually don't really know what a doula is. And then once they find out that don't know the difference between a doula and a midwife, right? And so
So what is
you're
the
not gonna want to
difference?
take it. Yeah, you're not gonna want to take advantage of something if you don't even know what it is. And obviously the difference between the two, midwives can actually help you through the entire process, hands-on delivering the baby. Doula is just there to be an advocate, go over your birth plan with you and make sure that somebody is there to advocate with you, and support you during that birth process, and especially when engaging with the healthcare providers. So the second thing that I have to say is access, right? Because working with a doula midwife does cost, and a lot of our brothers and sisters out there can't afford what it is. But yet it not only is it an important option to take advantage of during the birth process. I think it saves lives, and there's a lot of doulas and midwives out there who recognize that the cost can be a barrier, And so they do a lot of work pro bono, often, choosing to not pay their own bills because they want to make sure that their clients don't have to choose between getting bills paid and bringing their babies into the world happy and healthy. So the access is the other part. And then we have to talk about really the systematic and structural racism within our healthcare system, right? So, okay, now you know about a doula. Now you've been educated about it and you got access to it. As was stated earlier, some hospitals don't provide them, don't have lists for them. If you aren't able to solicit the services of them, some are not made to feel welcome within our healthcare systems. So our families in there kind of battling a racism kind of head on, and having to deal with that power dynamic of dealing with a healthcare professional like our doctors and our community members. Often there's one thing that's not often talked about, that power dynamic, where the way our healthcare professionals talk to and deliver information or keep information from our community members. And instinctively, our community members may feel like they're not getting the right information or feel uncomfortable dealing with the healthcare provider. But if you're anything like me, who was raised in the South and both parents are from the military, you're taught to defer to authority. And so you kind of keep your mouth shut and kind of take the treatment that you're given without second guessing it head on, and kind of take what's given to you, which could cause dire circumstances to some of our families. And then the fourth one is important, especially as it pertains to breastfeeding. It's trauma. We have a lot of sisters out there who don't want to engage in breastfeeding simply from the passed down trauma, historical trauma of, their ancestors having to be wet nurses. That's something we don't often talk about. When you talk to some of our brothers and sisters and you ask them about breastfeeding, those who do know what it is talk about this discomfort and this feeling of not want to do it because it doesn't seem right, right? The fact that a lot of our women's breasts are over-sexualized. Instead of being seen as baby's first food, they're seen as sexual objects. So that steps in the way of the breastfeeding process. And so I think when we're talking about delivering like holistic wraparound care to our families, we got to talk about all those things and all those things being significant barriers to the birthing process for our families and our communities.
Definitely, you definitely hit on a lot of high points there. Kayla, you want to add in?
Sure, yeah, so many great points were made, and I just want to expand on what was said. Absolutely, when it comes to access, we're dealing with implicit bias. Black, Indigenous, women, Latino, Asian, coming into hospitals, if you do not fit the mold of what looks like privilege or money or possibility, you are going to get a certain treatment. You're going to get black and white. You're going to get just enough information. And if you don't know what a doula is or how to advocate for yourself, you're not going to speak up because you are taught that what is in front of you is the expert, is king, and that's that. So, it's tough because what I love about being a doula is coming back with the mother and saying, okay, how was your doctor's appointment? What went on? What are the things that you didn't get to say? Because often there's because of trauma, because of information that isn't shared, maybe because of generational disconnect, whatever the case may be, there are a lot of things that mothers or expected mothers don't get to say in that room, and they're not encouraged to either. If you are of privilege and if you look like you fit the mold, they're going to give you everything. They're going to sell you in vitamin infusions, which is something that I highly advocate for, because a lot of, especially Black mothers who are expectant are iron deficient and other vitamin deficiencies in their body, or just lack of minerals, or that is not talked about as much. It's more so, oh, here's the red flag. You should be concerned about your high blood pressure. You should be concerned about diabetes. You should be concerned about your heart. And it's too much of a scare. And so when you push people into a corner with that scare and that information, there's no room for them to grow and them to explore and them to enjoy the journey, which they really should be. And then the next thing is trust. Something that was said is that mothers don't need to trust the system more. The system needs to be more trusting of the mothers, because we are the first experts intrinsically knowing our bodies, what's going on, and should be able to vocalize without being shut down or without being told, where'd you get that from? Did you Google that? Or, it's a lot of that goes on in these rooms. And then the next thing I want to talk about is, it's great that William is here because I don't know if William is a father, but fathers are often left out of the equation. Now, whether you are a partner, boyfriend, just there as an advocate, whatever the case may be, there are many instances where males are in the room and they are being ignored. They have questions and they are not addressed, they are not answered, and they go home feeling misinformed, inadequate, not a part of the equation. And then all they get is the backlash from emotions and hormones and unanswered questions, and they feel helpless. So it's a balancing act. It's not just the expectant mother that's being affected, it's the partnership. And when there's disconnect and it's not encouraging in that room for the partnership to strengthen, men actually can be the greatest advocates for mothers in the birthing process. Absolutely. For many reasons. I don't want to take up too much time, but that's what I wanted to add.
Hansay, I saw your hand up. Did you want to add something?
No, it was still up from previous.
Oh, okay.
Oh.
So we've heard about a lot of issues that you all have brought to the forefront. And some of the things that are really coming up for me are around the trust, systemic racism, this gatekeeping around information and services, particularly for Black mother. When you look at some of the data, you can see that a high income, highly educated Black mother has far worse health outcomes than a white mother who does not even have a high school diploma. So what's going on there? And so I think you all have brought some of those issues to light for us around the lack of education as well, and the power dynamic, the white coat syndrome. You see this person in front of you, you expect them to have your best interests at heart. They're supposed to. You think they're giving you all the information. And then you may be looked down upon for doing your own research. And Kayla, you mentioned, like, where did you get this information from? Does it really matter where you got the information from? If I have the question, then the question needs to be answered, right? It's your job as the healthcare provider to make sure I have the right information and dispel any myths that I may have found on the internet. Because that is a resource, that is a tool. Now, there obviously needs to be some education for consumers, for mothers, et cetera, on how to find good quality, credible information. But that's not the point. When you're at the healthcare provider, you need to get adequate care. You need to get culturally tailored care. You should not be dismissed because you have more questions than someone else, right?
Absolutely.
Or they look like your pocketbook isn't as long as the next person's. It does not matter. You should all be getting, the same care as well. So we talked about a lot of these issues. A lot of them are very much at the systemic level, very much at the foundation of our broken healthcare system. Let's talk a little bit about, what are some of the reasons for some of these issues, and how do we go about combating some of those issues as well?
With some of the issues in terms of the systems we're dealing with, or just issues overall when we talk about combating them when it comes to Black maternal health?
Any and all of those.
Ooh, there's so many. How about I touch on
That's
it?
a whole webinar in itself, right? We could be talking
We
about
don't have
that.
enough time in the webinar, right? No, I will talk. So I'll talk specifically. I want to key on something that Ms. Kayla talked about, and I'm so glad that she kind of like teed it up, and we talked about the importance of fathers being in the space, and fathers being in the space. Like I said, that idea is sparked the whole initiative of how and why I became trained as a doula and lactation educator. And what I want to highlight about that is one of the issues. So one of the issues I'm going to call out pertains to just that. Watch the language that we all use, especially healthcare providers, but one of the things that also people in our own homes use when it comes to the birthing process, when we talk about whether or not men are involved or not involved. Because not only does the healthcare system do it, I can't tell you how many times I've heard when working with families, you have a young brother who's excited about having a baby, right? It's like, yeah, man, we about to have a little, we like to have a little boy, we about to have a little girl, we're pregnant, we this, that, and other. And it's sometimes it be like, what's the saying goes? Sometimes it be your own people. It be friends and our family. Sometimes it be like, you aren't going through anything. Your feet aren't swelling. Your back isn't hurt. You're not getting morning sickness, yada, yada, yada. So, and what that does is, both consciously and subconsciously over the course of that pregnancy, you're delivering messaging to that man. Even though logically we know it's not accurate, we're giving a messaging to that man that he does not matter to the birthing process other than helping to create that child. And after the child is born, to help financially support that child and to discipline that child. And we know that's not the case. And by the way, the whole aspect of men don't go through chemical or biological changes is false as well too. Some men go through these hormone changes along with their partner during the birthing process. They also even experience a postpartum depression just like their partners do. So we need to start reframing this language. And when I consult with and work with direct care service providers and public health home visiting nurses, I make sure to tell them that too, that when you walk into a home and you work with families, stop just addressing mom and child, or just talking about mom and child. When you talk about the family, that includes a mom, child, and the father or partner, or grandparents, or aunts and uncles, because a lot of our families we work with, we are supported by extended families. It's not just the traditional mother and father, or just mother setup anymore. And I think that's one of the biggest obstacles that we face is even our quote unquote family services are only geared towards mother and child or mother and baby. Fathers rendered utterly invisible in that process. And like Ms. Harley was saying, like there's cases of men being in the room asking questions and doctors and nurses talking over them, around them, through them, but never to them. But then when the baby is born, we expect like a lot of fathers to kind of jump in, like head first to support, and it simply doesn't work that way, even though they want to, because you over that entire time have been delivering messaging to them that they don't matter, and they do a great deal. And especially in terms of they can be ones there who are also advocating for our mothers in that space when our mothers are asking questions, or those doctors want to drug test our Black and brown women more often than white women after delivering their babies, can speak up and support our mothers when our mothers are talking about hey, this doesn't feel right, I need to be looked at, and doctors and nurses are ignoring them and telling them that it's not a big deal, when in fact it could be something seriously happening to them internally, leading to death. They can be there to help advocate for our mothers in that process. So we need to stop with first we need to change our language, and we need to stop with this perception that the birthing process is all about just mother and child. I always say, because every time people find out I'm a doula and lactation educator, they always go, "You're a doula? Isn't that women's work?" And my response is always like, "No, taking care of the family is family work. Birth work is family work, not women's work." And until the first step is really changing our language so that it can help and inform and change our perspective of what that dynamic looks like. So that's just one of the things that I wanted to kind of jump in there on, and I'll see the space so others can kind of get in and talk.
I want to tap into something you just said, talking about getting into the man's psyche even before the baby is born. And then, he could develop a defeatist attitude and not want to be engaged with childbirth and child rearing.
Oh yeah, that runs.
How do you
Yeah,
help them
I'll tell you how.
overcome that?
Yes, I'll tell you how I work with that, because that's a whole nother ballgame. So often when people ask me how I'm a doula versus men versus women, I always tell them it's completely different, right? When I'm working as a birth worker with women, it's very much exactly how you would think, right? Building relationships, getting to know one another, understanding comfortability, knowing about their healthcare providers, developing that relationship, the whole 9 yards, building that rapport, talking about a birthing plan, the whole 9 yards. I can do that with men, but with men, I have to break down the whole concept of stereotypical gender norms and help them understand that they have a space to reclaim their space in their homes and their communities that they've been rendered invisible in. And I often do this with 4 questions. It's 4 questions that I use even when I help co-facilitate men's groups. And the 4 questions are, the first question is, who gave you what is your definition of man or masculinity? And the answers I get are very typical, right? Having autonomy, being a protector, being a provider, move how you want, do how you want, nobody can tell you anything. Second question is, where did that definition of masculinity or being a man come from? Also get very predictable answers, right? Father, grandfather, coach, older brother, older cousin, yada, 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 so on and so forth. Third question is where it starts to get real interesting. Third question is, does that vehicle of a masculinity or definition of manhood, the person who gave you that, do they live up to that definition? Now things start getting interesting, because they're not so quick to answer, right? Now you start to see, eyes kind of looking up in there, and they started thinking about it. And it's at that moment they start to give you the answer like, no, they don't. Because at that moment they start to realize something that I learned about human beings a long time ago. Whatever limitations we have, we subconsciously and innately like to place those limitations on other people. Whatever I'm capable of, you may be capable of. Whatever I can't do, you can't do. Right? So then the fourth question I ask them is, if you just gave me your definition of masculinity or what being a man is, you told me that, and that encompasses you being able to do what you want, move how you want, live how you want, so on and so forth. And you've just indicated to me that your definition of being a man or masculinity comes from somebody or something that doesn't even live up to that expectation, then you in fact really been behaving as a man or masculine, as you've always said. It's at that moment, the fourth question I hardly ever get answered, because it's at that moment they all realize that for most of them, not all of them, but for most of them, they've been living their whole lives by somebody else's definition or framework that doesn't even live up to that definition or framework themselves. I'll tell you why this is important. Because once you do that, you start to break down the barriers of what's possible and what's not possible for a lot of these men. And unfortunately, because of stereotypical gender norms, what's not supposed to be possible for a lot of men is being active in that birth space, right? Because that's quote unquote a women's space. Once you do that, there's a whole new realm of possibility. So however I do it, with some men it's different than others as far as what that journey looks like of making it possible and making it comfortable for them being there and empowering them. I always start with those four questions. I feel like you always have to enlighten them of, what is your autonomy, dude? Like what is it you're here to do, and how have you been moving and living through this world? Because if you've been living by somebody else's standard and that person doesn't even live by that standard, my man, you haven't been moving at all.
Well, I'll just say preach on it right there. I love the fact that you said, looking at someone else's definition, if they're not even living up to it. So how are you even moving, in this world and in this space? And it really is up to you as an individual to decide what type of partner you're going to be, what type of parent are you going to be, and you breaking down those molds and those barriers and forcing people to have those deep conversations about, well, who do I want to be moving forward? Right? Particularly if my role model, quote unquote, has not been living up to the standards that they set or I have set, right? So I definitely appreciate that type of honest conversation and really bringing men into the fold so they can be better partners, be better parents as they go through this parenting journey. Anyone else want to add to some of the strategies on how we address some of these issues that we talked about, whether it's at the individual level, at the systemic level?
There were so many similarities in what William was saying in comparison to women when it comes to our own individual birth experiences, right? Some of us are, we feel like we have to move forward within our pregnancies just as our aunties and our grandmas did, right? So if everybody had C-sections, okay, I think I got to have a C-section, right? Also with the older generations, they were taught to obey and listen to whatever the doctors said, to not trust your intuition. Trusting ourselves and our body's natural innate wisdom has been stripped, from our bloodlines. When you look back historically, we played the major part in in birthing experiences. So helping our women to reconnect to our ancestral wisdom, to our cultural birthing practices, we're reminding them, but it's almost like we have to just change their whole mindset, right? When it comes to using their voice, that, somebody mentioned that you are the expert of your body, right? Nobody knows your body better than you. And this is your birth experience, just like the fingerprint on your finger. We all have one, and it is our birthright to birth the way we want to. But teaching them to use their voice, and yes, I can go in here and ask questions. I can say no. I can say this does not feel right, and I'm going to decline today. I'll go home and think about it, and we'll talk about it the next time. right? Even moving with that flow is going against what grandma and auntie going to say. You said that to the doctor, yes, because something is telling me this does not feel right. Giving my baby 6 shots at one time, something's telling me no. So it's a whole retraining and education process that we have to go through, teaching our women. Look at what our lay midwives used to do. Our village mothers, doulas have always been around. We are the keepers of sacred birth, right? And it's nothing I believe that we need a certification for, right? Once you reawaken that thing, it's in us. So it's just a retraining and a revamping of the mind. And when you ask women about these things and fathers about, and remedies and holistic practices, they remember seeing their grandmas, get that red raspberry, tea out, and doing all type of things. So that reconnection of who we are and what's already embedded and implanted in our bloodlines, and that seems to work for my clients. Like, wow, this is a real thing, right? That I can take control and reclaim what our foremothers had started.
So how do you get women to open up and trust and believe in themselves, particularly if their family members have different views about how they want to embark upon their birthing journey? So they have people in their ear saying, you got to do it this way. How do you help them overcome that and create a new narrative for themselves?
Yes, I find since 2012 have found the best way is to first provide sacred safe space, right? As Black women, we have built up such an armor around ourselves to be vulnerable and to speak our minds, because it might sound odd, the things that, we're saying. Something is telling me to eat some greens instead of taking these pills. Things might sound odd when we say it, but to bring them in a safe space where they feel comfortable to talk, it's judgment free, and also providing women and sisters that's on the same journey as they are, that look like them, and we share the challenges of pregnancy, the ups and downs, right? And also having women in that circle that has already attained what they want, the goal for their birth. So if it's a home birth, we're going to have some women in the group that yes, have had a home birth. If it's a VBAC, I want you to see a woman in front of you that has accomplished a VBAC, right? When we see our sisters that has done this very thing that our heart desires, yes, it helps give us confidence, like, I can do this. And we share that wisdom. We support each other. We provide the resources. We provide the sacred space to be able to work through the traumas, to break down those barriers. You were talking about breastfeeding and women not even wanting the babies to touch our breast from sexual abuse, right? That healing has to start somewhere, even with the sexual abuse and all these things, for us to get to a healing state to move forward into, the breastfeeding. So yes, supporting each other, in circle and throughout the pregnancy, birth and postpartum journey together. I feel that it was never meant for us to do this alone, right? We were village people, right? We were together, and we would go to the birthing mom's house, and someone was boiling the water, somebody was tending to the mom, helping her to breathe, right? This is how it should be done. So we're definitely strengthened by numbers, right? Coming together and educating and sharing our wisdom and experiences.
Definitely. And I appreciate the community connection and the sharing of the wisdom and sharing of the resources and the knowledge. I think so many times we go through so many situations alone in life because we are afraid to ask others what have they been through, and afraid to build that connection and community as well. Kaylee, you want to add something?
Yes, I just want to echo what Pansy just said, just beautifully. Even going back to the history of us creating sacred space and not doing it alone. That's the beauty of being a doula and having that advocate, and really it's a best friend. It's a birth
Yes.
journey best friend, really, that person
Mhm,
who you can
mhm.
confide in fully your wildest thoughts and feelings
Yes.
and doings, like, and feel safe with that person. Hey, this is what I'm thinking, but I know this person is not going to judge me. And that is something that's obscure for a lot of, namely Black women, who have not had support before. So it's like, oh, I get this luxury. What is this? I've never had this before. It's almost a challenge for them to sort of accept the help. They have to grow into it. And sometimes it takes that first trimester for them to get used to it, because they're so used to plowing through, doing it all. Even some mothers will try to coax it and hide it from their workplace, from their friends and their family, that they're even pregnant. They just want to see how much can get done while they secretly prepare for this new life. It is a real thing. It is a real thing. People must know. So, the baby blues and the depression and all the things that they start to feel, that doesn't just happen during the postpartum phase. That happens. I always tell mothers, you are a mother from the time of conception. Own it, become it, because everything you start to think and feel and speak to yourself and out loud is your reality. And that's how you're shaping not only a safe space for yourself, but a safe space for baby, because that is also felt and heard and experienced. As a holistic full spectrum doula, I open mothers' eyes to maybe the things that they weren't introduced to. Number one is breath. It amazes me how that is eliminated from the childbirth education. There's not enough discussion about breathing techniques, rhythmic breathing, movement and breathing, being in water and breathing, using it as pain management, using it when you're having panic attacks. We've got moms here who are already on medication for anxiety or maybe asthma or bronchitis, or they have pre-existing conditions that actually breathing can help bring them back to a place of autonomy, and if not control, power, just breathing. And then also movement. So it's in my bio, but I'm also certified gyrokinesis and gyrotonic instructor. Gyro means gyrate, and kinesis is like kinesiology, the science of movement. And really just sitting, standing, or lying down, I walk moms through this cipher of movement to help them to feel their bodies, be in their bodies. And I'm like, all right, we're on our hands and knees now. All right, we're doing this now. And the flow is majestic, because I want them to get used to being in their body and moving naturally. So when they get in the room, it's not like, oh, what do I do? What do I hold on to? Who's got my legs? That is, it's very terrifying for a lot of mothers. Actually, Tatiana Ali, we know her from, oh, let me lean in. We know Tatiana Ali from Fresh Prince of Bel-Air. Her baby was practically taken from her, suctioned from her womb. She was held down. She and her husband were saying no, and it was very traumatic. And oftentimes when this happens to mothers the first time, where they feel like they have no say, things were happening beyond their control, even after they said no, or the doctor or OBG or practitioner said, this is what's best for you, we're just going to take action now. The second time and third and fourth time around, they are radical about what's not going to happen that next time around. So that's what a doula can come in and say, okay, it's your world. How can I be in it and help you to bring this to life? Because it's all you. It is all you. And I think that's the best thing that we can share with mothers. But the other thing about it is we have to recognize that there's still work to be done. There's still work to be done. And that's why we need the community. We need the village. We need the voices. We need the change in policy. We need that still, because the work has yet to be done. I've had instances where mothers have had to get notarized letters being in the military because they were deemed insubordinate in wanting to take a holistic approach to their birthing process in tandem with what was already happening. So she wasn't saying, no, I don't want nothing that you're offering me. She said, I would like to bring this as well into the room. And they were saying, we're not familiar with that. That's not protocol. We're going to cancel that out for you. And she had to make a conscious decision to go elsewhere. And they almost were not forthcoming with her records. Imagine that. So I just wanted to leave with there's work to be done, and it doesn't just start with the mothers and doulas, midwives, and birth workers. It is the family, it's everyone that you care about. There's work to be done.
Absolutely. And I like the fact that you said, as a doula, you are her birth journey's best friend. And I hear all of you saying you are putting the mother first, putting the father first, and putting them at the center of decision making, empowering them with the skills and helping them to build their voice so they can advocate for themselves. Can you all speak a little bit about how you support them in interacting if they do have OB that they are seeing, and maybe you're not at the appointments, but they may have questions or don't know how to interact or best communicate with their healthcare provider?
I would say overall, I often ask, like, what questions are you answering? And if there are questions that I hear should be asked, I'm always telling them to ask other questions. I'm also just knowing, like, they know, like, their basic, like, rights and stuff like that. Like, if you're working with a healthcare professional that you genuinely don't feel comfortable with, you can request to work with and see somebody else. And there's a lot of folks that don't even know that. Like, they think they have to stick with whoever they have to stick with, right? I'm like, that's not the case. So I think really, for me, the easiest way is just making sure, like, what questions are being asked in terms of, again, when I talk about fathers and stuff like that and inviting fathers of the space, are they inviting, your partner or the baby's father in the space? I just answered one of the questions in the chat too about, like, how important language is, because language is so subtle, but it really, like, conditions how we move and how we do things, right? Like, for instance, when I am working with families, when I'm visiting with, like, public health nurses and stuff like that, like, especially public health nurses and stuff, I always tell them, like, stop calling a lot of these moms like single moms. I'm like, is dad in another room? Well, yeah. All right, then stop, because they're not married. Because I call them, especially in terms of, like, Black fathers, because data shows that although Black fathers are more likely to not be married to the mother of their children, they're actually more active in the day-to-day lives of their children than any other demographic of men, right? And because that bleeds over into the language of our parents. Like, for instance, I had to tell both a healthcare provider and a young lady once. They were talking about, like, because there's a little bit of friction between the mother and the father, and I'm asking questions about dad's involvement. I'm like, oh, so he's not around. Oh yeah, he'd be around, or he doesn't provide financially. Yeah, he provides financially. They got other kids too, right? Or he doesn't, take the kids here. No, he does that too. I was like, well then, ma'am, you're not a single mom. You just don't got a man. Like, y'all co-parenting. Like, stop saying, and it goes for dads too. Like, if you are the primary custodian of your children, which there are a rising number of men who are the primary caretaker for their children now, same goes for men. If mom helps financially support and take care of that child, if mom is with that child half the week doing things with you and stuff like that, brother, you are not a single parent. You are co-parenting. When you use language like that, when it doesn't pertain to the situation, and I mean genuine co-parenting, I'm not saying, mothers or fathers who have been abandoned by the ex-partner or whatever, but you genuinely have somebody who's there, whether or not you're in an active relationship or not, who asks questions about the prenatal visit, who wants to come to these visits and all this type of stuff. You're not single. You're not a single parent. You might be single in relationship, but you are co-parenting. Even when you are not in a relationship and that other parent is asking to be along with that visit, trying to get information, be prepared and help out with that birth plan, trying to make sure that y'all have all the resources you got, you're co-parenting still. When you say that you are a single parent, when that other parent is actively trying to be engaged, simply because they're not in a relationship with you, you are building resentment between that other person because you're nullifying all their efforts. You are making it out to be that you are doing everything completely by yourself when you are not. And that's not okay. And then, whether it be mother or father, one of them's wondering why there's animosity while the other person has an attitude. They have an attitude because you're neglecting all the efforts that they're putting forth. And so that's one of the things that I've had to use with families, but you also have to do it with our healthcare providers because they're quick to do it too. If they do not see a ring, well, in the case of Black mothers specifically, they don't even look for ring. They just assume that a lot of our mothers are out there by themselves, which is not okay and not right. And so you have to make sure, like I always use language that includes an entire family, or somebody else, whether it be, there's a partner involved, there's dad involved, bring dad, bring partner, bring grandparents or aunt, uncles, unless I'm told explicitly, I am completely by myself, nobody is helping me, nobody helped do anything. That is the only time I talk to somebody and make sure that the healthcare provider knows to not add somebody else into that equation.
I wanted to add that, and thank you for that, William. Equipping the moms and families with the tools, right, to kind of weed out and see if this is a good provider for them. But all of my clients receive a questionnaire, whether or not it's a home birth midwife questionnaire that's going to ask about your statistics for the year transfers, or if it's an OB, we're going to talk about post dates, and protocol for post dates, or interventions and things. At minimum, I'll attend 2 appointments, doctor's appointments with my clients. Someone else mentioned that white coat syndrome. Some of us get in front of doctors and kind of freeze up. Well, we have all these questions when we get there and come out. We haven't asked anything, right? So making sure that they have all these questions in front of them, they're highlighted, circled, they're taking notes, or I'm there to ask the questions, and I'm watching for the dynamic with the doctor, whether or not you're getting an attitude because we're asking about mom and baby's health, right? So that's very, very important. They need support, again, when it comes to what a lot of us see as a authoritative figure, right, and assisting them with getting the answers, and that leads into, is this the correct provider to assist me with my pregnancy and birth?
So I'm hearing a lot of common themes about, making sure mothers are asking questions and making sure they have plans in place. So one strategy to, make sure the mother gets the birth that they desire is to have a birth plan. So can you all talk a little bit more about what is a birth plan? How do you fill one out? What are the components of it, and how do you use that to help guide the journey?
Go ahead,
for it.
Kayla.
Go for it.
You can go ahead.
I mean, there's so much to it. Essentially, the birth journey is, I always explain to mothers, how do you see your birth? What is, first create the most ideal picture. What would you like? And then I ask why. Sometimes people come and say, oh, I just want a ward of birth. Oh, I just want a nice doctor, and they don't know. And then I ask them, well, why? Oh, I've seen this before. This person has talked about it. So you walk them through from the time they learn that they're pregnant to that first, second, and third trimester, into even the postpartum phase, which a lot of people forget about, what things are important to them. So that could be anything from financial budgeting and planning to who's included in your circle, your family, your partner. What do you need from them? What does your work and your schedule balancing look like? When do you need to go on leave? Do you have other children? How would you like for me as a doula or anyone else to support you with that at all? Nutrition, what things you currently have implemented? What things would you like to change, do better, improve? I always encourage them to get blood work, just to look at the facts first, and then we start to taper and work through that. I mentioned before, maybe IV vitamin and mineral infusions, or maybe talking to someone specifically, a dietitian, holistic. I prefer holistic, African or Black dietitian to help them with that as well. Then we talk about, what does that look like leading up to going to the hospital, the actual birthing experience. Who do you want there? What do you want to happen? What pain management would you prefer? What is ideal first? Do you want intervention? Do you not want intervention? At what point are you okay with, if they say we think this is best, are you okay with that? Or do you want to completely be resilient? What kind of support do you need with that? And I'm pretty sure people can chime in with some more things if I hadn't mentioned. And then definitely talking to them about breastfeeding and lactation and preparing for that. What does that look like in your lineage, your heritage? Are you looking forward to this? Are you not? Let's talk about your past. Let's talk about if there is any trauma, or if this is something that is a first time for you. Then let's talk about how we can get you physically and metaphysically ready for birthing. What does that look like? Do you need to to increase your exercise? Do you need to, what does that look like essentially? And then the birthing day. I'll let someone take that. And then postpartum, this is the part where a lot of people forget that they're going to need support. They assume, oh, once I've had the baby, I'm good. And they just start reeling into, when am I going to get my body back? When am I going to go to work? When can I start doing me? And they don't realize that that is when the full release of the hormones have dropped. You're feeling everything, and it's going like this, where it might have been cute during pregnancy, where you have these flighty hormones and just like, oh, she's pregnant, to whoom, baby's crying, screaming, needs you, you're trying to recover, you're bleeding, you're uncomfortable, you're trying to navigate, what are the right products for me? What kind of products do you want? Do you want to only use organic products? Are you okay with conventional? There's so much to explore with the birthing journey. And I just started with a simple questionnaire. And then over time, they change. Sometimes what you may say in the beginning, you realize, well, this is different. I want to explore this now. Or you go from, I want to be in a hospital to, I want to be in a birthing center. I want to be in a birthing center too. I might be comfortable at home. Again, that's where the doula comes in, to walk you through that journey as you evolve and discover what things are working and what things are not working. But it's always great to have a preliminary survey and just discuss it through and have someone to see through that journey, essentially.
Pansy, you want to add something to that?
Yes. So the birth plan, I believe it's our platform to, relay the vision, just like someone said, of our birth, right? And to just kind of like reclaim your space. So using very specific language to portray and let, the hospital setting know that I'm just not another number on the board, that this is the sacred birth of baby, so and so, attending and supporting me, using those terms. Yes, I have family members, I have doulas, I have, my partner, my husband that will be supporting me with this sacred birth. I ask that you use low tone voices, letting them know that this is sacred space. New life is being brought to this realm. So kind of, laying that down. The biggest part though is the education, teaching our moms and families how many options they have, when it comes to when we have to come and deal with Pitocin. So many don't know that, yes, we can start with a low dose protocol. I've come into some doctors, I've never started at 0.5 with Pitocin. Yes, we can. And it works very well to let the body, see how the body tolerates, see how babies, tolerate it. We don't have to start at an 8, or a 10, and we can work our way, up every 30 minutes, right? So that's on the birth plan. If Pitocin comes into play, I like to start at a low dose, protocol. Circumcision, even if we do want circumcision, we do not have to inflict trauma right there. We can have a moil come to the house, or you can go to the moil's office. Like, what? I don't have to have my baby strapped down and, given a needle right there. And I can't be next to my baby to touch him, to talk to him. It's so many options, right? So that education piece is key. Of course, on the doula's part, we have to be educated. We have to be tapped into resources, studying, staying abreast, on things to relay, all of that information. And like Kayla said, as the education moves forward, a lot of times our moms' decisions, change. I have clients that come saying, okay, I want a hospital birth. But if they sit in circle with, home birth, moms, it's like, oh, okay, I think I want to do this. Or birth center, moms, oh, I think I'm gonna try to do it without a epidural, right? So that education piece, that support piece, but also helping them to find their voice and to get comfortable that on this birth plan, I want you to relay what it is that you want, recognizing that birth can be very unpredictable, right? And that we have to surrender a lot of times to what the body is saying, what the body is doing. So we're open to that, but we're going to say, please don't offer me any pain medicine unless I ask you for it. That you will hear, meditation music, and I'll be using aromatherapy and using body movements and different things like that with it.
Awesome. That is really great advice. And I did not even know that all of those things could be included in a birthing plan. So it really goes back to, again, having those conversations with the mother and seeing what does she desire? What does she want? What does she want this to look like? So I want to segue into the audience Q&A because we have some really great questions that have come through the Q&A function. So there's a lot of conversation in the Q&A about how does one become a doula or a midwife? And do you all have any advice that you would give someone who's considering becoming a doula or a lactation consultant?
I can start. Well, here in Baltimore, I think it's July 21st through the 23rd, the Birthwell doula training organization. I'll be training this new class of doulas. So that's where I know COVID has brought on a lot of online trainings, also for doula trainings. We also have quite a few scholarships that's been going on here through the Bloom Collective, certifying lactation, consultants. So I think, with so many of us working towards, the goal of better outcomes with our, Black and Brown sisters, there are a lot of different resources to assist with training and certifications.
And I think something I would add as well is just reaching out to your resources in the community.
Mhm.
I know I love when someone reaches out to me. They're like, oh, I'm interested in midwifery. I'm interested in nursing. I have so many little mentees across the internet. I've had people reach out to me on LinkedIn, just getting people plugged in. I think a lot of birth workers, especially birth workers of color, we understand how important our role is and how we need to really get more birth workers in every kind of way we can, and especially birth workers of color. So I know when I see somebody reaching out to try and just even get some answers or just some direction, it's not too difficult for me to just try and answer a question or just at least get them to someone that can be very helpful, and just go for it. It can be a tough journey. It can be an emotional journey, but if you really think it's your calling, it's so worth it. And that when you do get there, take up space. I'm a midwife in a hospital setting, and there are days it's tough with what I'm trying to do and the energy I'm trying to bring to the environment. There's a lot of culture shock and culture changing happening, but don't forget why you got into it. And when you do get there, don't forget to take up space and continue doing it. There's a lot of, I feel like, birth workers or healthcare providers, at least in the setting I'm in, that maybe had good intentions, but they get the trauma of seeing something go wrong and they carry that forever. They never do the healing. I know I've seen some, hard situations, and I've had to heal from that. So I didn't push that onto my other clients and take away from their experience. I always think about my first uterine rupture I ever saw fresh out of graduate school. That was tough to see, but that doesn't mean every patient who wants to have a vaginal birth after cesarean that I need to hold on to that fear and push that onto them. And so many of my colleagues wanted to remember that moment and, push that into your mind. And I had to remember why I got into it. And so just hold on to why you got into it. Hold on to your space. Take up space when it's time. And just reach out to your community. There's so many of us that would love to help guide you.
Yeah, I would say, coming from me, just the two questions you need to ask yourself first and foremost are you willing to do the work, and are you a caring person? Because those are the most important things. You got to be a very caring person, because you are working with people in some of the most exciting and also possibly some of the most traumatic times of their life. So you can't be some callous, nonchalant person doing this work. And it's also hard work. I mean, it can take up a lot of your time. Being there for a family during the labor, like, you can't be having you got to clear that schedule is basically what I'm saying. You can't be like, oh, well, I need this baby to be out by 6 o'clock. I gotta go. That's not how it works. My dad used to always say there's only two things in life that are undefeated: time and nature. Like, when nature's taking its course, nature's taking its course. So I would ask yourself those two things. Nothing else I think you need to worry about. Like, you don't need to worry about what you look like, your background, none of that type of stuff. And that's coming from me, like, because please believe me, like, early on starting in the work, I got plenty of questions. I understand that, for most people, when they look at me, they think that I don't look the part. Because again, stereotypical gender roles say that typically it is a woman doing this work. I am an ex-college football and semi-pro football player. I have over 30 tattoos. My dreads go down to my belt line. I'm 240 pounds. Like usually when I walk into a room, people are asking either whose uncle or whose bodyguard is that? Nobody is looking at me and necessarily expecting me to be a birth worker. But that doesn't matter because I have the acumen and I have the heart and the spirit to do the work. And if you have those things, you could do this work too. And we need more birth workers out there because our healthcare system, I'm not a person who's completely against the healthcare system. So don't, as I say these things, don't take it as that. There's some things that our healthcare system is very great for, but by and large, as it pertains to Black and brown mothers, our healthcare system has not treated them very well when it comes to the birthing arena. So we need more people in that space who are willing to advocate, and if need be, in some cases, like fight, like bite, scratch, and claw, and make them sure that they are heard, and more importantly, their clients are heard. We need more people like that in the space. And if that is you, and you think you have the heart, and you think you have the time and energy to do so, then I urge you to seek it out.
Absolutely. We definitely need more people who look like us in
Yes.
the system for sure. So once gotten your certification, gotten your training, how can one keep their skills sharp and enhance their skills as they embark on their journey to becoming or staying a doula or midwife?
If I can just double back real quickly to say that, early on in my journey, I read a line from a senior midwife, and it read that before you go out and tend to women in the community in birth, first midwife thyself. And it stuck with me because as Black people, we have so much trauma, right? That we just have, we really don't, a lot of us don't even have the time, right, to even deal with it. But when we go into the sacred space of birth, it will trigger something sometimes. And we cannot bring, our trauma, our emotions, our experiences, our fears into our family's birth spaces. So if if the doctor walks in and, you're scared to use your voice to speak up and advocate, the mom's going to feel it, especially if you guys have created a bond and a connection. Energy is transferable. If you're touching her and you're nervous, you're scared, you're thinking about your loss, we're doing a disservice, right? So all of my mentees have to go through a process of spiritual cleansing and healing with me before they start to attend births, to make sure that we're in a good state to hold space, to hold that sacred space. Moving into, how do we keep our skills sharp? I do have a mentee or mentorship program, and I allow them to shadow, home births when a client allows or open to that. But with the consistent classes and circles in childbirth education, everybody's welcome. Giving them opportunities to teach. If we're teaching on a consistent basis, you want to start to retain that information, right? And all type of the postpartum ceremonies, my honoring ceremonies, womb blessing, having them to be hands-on. Again, how our ancestors used to do. Historically, we were in it, have our hands in it, and learning. And I think for me, when I became a birth assistant, it just assisted in keeping me sharp, and it assisted with growing my doula business. So I do believe you need to stay in the work and stay fresh. Keep reading, keep researching to stay abreast.
I was just going to say that being a doula has made me a deeply compassionate person. It's so fulfilling in that way because the nature of it is that you're pouring into someone. So just like Pansy said, or Penze said, excuse me, you have to pour into yourself. That's precisely what I was thinking. If you understand how valuable that is, it becomes easier for you to be present, because really that's what you're doing. You're sharing with someone your presence, and you're being a soundboard, and you're being a great listener. It's a balance between the book knowledge and the life knowledge. There's some things you're just going to have to see and feel and learn firsthand. And there are other things you're going to need to give your clients or your friends or your persons who you're connecting with, you're going to need to affirm that with the knowledge that you've acquired through study. So have both. And once you get connected to a community or network, whether it's what you've gone through for certification or something else that you found, stay connected to that. Be proactive, go to workshops, sign up for things, stay curious, stay, willing to fill your cup up, do your own reading. And it doesn't always have to be birth related. Actually, it could be something else. I was just overwhelmed with how much the breath work really helped mothers. And I didn't expect it. I actually did it for myself because I'm a chronic pain warrior, and it helped me to diffuse a lot of the things that weren't working for me when Western medicine was given to me. And then when I translated that into my doula work, people were saying, this is what's missing. Thank you. So I would also say, listen to what your innate qualities are as well, and what gifts are gravitating towards you, and see, consult with your mentor, consult with your teacher. Can this serve as, in this space when I'm a doula? Because it very well could. You'd be surprised. There's a lot out there. There's hypnobirthing. Maybe you're a singer. You can create lullabies for baby or for mom to go to sleep. Sleep deprivation is huge, especially during the postpartum period. See what other things life can bring into your practice, and then open that up in your work.
Thank you. Another question from the audience. What's the longest period of time that a person can have a postpartum doula? Is it 6 weeks, 12 weeks, or longer? Or is there a set time?
There is no set time. I've had mothers stay with me until baby was 2.5. She just felt like we had a bond. When you have a bond, that cannot so easily be broken. And then it sort of just tapered into other things that I am certified for, where she was kind of consulting with me. Okay, how do I now get back into the workspace? Or what we were talking about, as a doula. But of course, I don't recommend that if you don't have the acumen or you're not certified for that. I'm also a digital marketing consultant, so I was able to talk about that. But there's no limit. I think people go with that 6-week cap because that's when you're supposed to return for the check-in. No, give it a solid. I really say give it a solid year for the postpartum period. But, if mother ends up getting pregnant again, you're still experiencing postpartum symptoms, if you will, even as you're pregnant and preparing to go into another birth. So.
Anyone else want to chime in on that?
I was just going to chime in from personal experience. I always tell people, because as a midwife, some people were so surprised that I took childbirth classes and I had a doula. And I was like, I think because I am a midwife and I know the healthcare system so well, like I purposely went out and did all those things. And my doula was amazing. She is amazing. My son is 15 months. I still reach out to her about little things here and there. I don't know what I would have done without my doula. So I think that's what Kayla said, just this is not like a 6-week cap. I think it's so many birth workers understand that. And so we had our little 6-week check-in or so, but she just still was always so available. And I think a lot of birth workers, a lot of doulas do that. And so highly recommend.
Awesome. Another question from the audience. What is the doula's role during bereavement, whether the loss of the baby is anticipated or not?
It's still to be there as a support. You've built enough, you should have built enough of a relationship and rapport with that person to just support them however they need it. Now, how everybody deals with death is completely different. Or you could do something like, for instance, I actually know here locally in the Twin Cities, somebody who's a death doula. And so, and let me be transparent. I've never had to deal with that situation myself, where a client had a baby that that died. But again, like I would be of service however they needed you to be. Maybe they don't need you to say anything. Maybe they just need you to check in on them just as you would if the baby was still there. Because one of the things that that it's not equivalent to losing a child, but it's also hard. It's like the postpartum depression part for a lot of mothers, because a lot of you may know, like when you're pregnant, everybody's like excited for like you and the baby when the baby's born. when people come over, they don't want to see you. They want to see your baby, and that's left leaving like a gap, a hole in the hearts of some moms because they've gone through so much, and they're still they're going through a lot. Just trying to deal with this new life and navigate that, how their body feels, how their minds feel, how their hearts feel, and yet you got people coming in like bugging you every second of the day, and they don't even want to talk to you, right? And so I try to take that approach. But even but as it pertains to death, like I'm lucky enough to have resources or folks, available, like a death doula, which does exist in case any of you all didn't know. And if it's something you want to learn more about, you can kind of like look it up. If you're, it's located somewhere here in Minnesota, the Twin Cities, I could direct you towards one. But she's awesome, and she deals specifically with that particular situation, how to help people deal with the transition of loved ones. So I mean, that's how I would go about it.
And my experience, definitely our families need us to be there. But the next questions are, what do we do now? Right. So what resources are available, support systems? I mean, I've done it myself, called funeral homes, now I have a list of funeral homes that may, offer certain discounts and things. Some hospitals, might sometimes say, you have to come get the baby by a certain time. They're trying to figure out it's just so much to have to figure out. So to know what the next steps are and be prepared with those resources, and they need options even in this arena, right? So what are those options? I also provide sacred ceremony for loss for my moms and families, because again, it's a sacred transition. It's a grieving period. At the same time, it was a life. It is a life that needs to be honored. And that's sometimes stripped away from our moms. Like, it just wasn't B. It wasn't a baby, and that's not fair. But to give them the space to honor the life of their child that they carried, and to help with that healing and grieving process. And going forward, what we say, when all the dust settles, then what? Right. So also having ongoing support circles for them to be, if it's once a month, twice a month, for them to be able to connect and share.
Definitely. Kayla?
Mm-hmm. Yes, I echo and agree with what William shared, what Panze shared. The more resources and togetherness and community during that time, the better. Again, we have to be mindful that it could happen to anyone. It could happen to a teenage mom, just in the same way it could happen to a middle-aged mother whose resources and finances are different, but the experience and the trauma and it's the same. So how can we show up for them? A lot of people don't know that during the postpartum period, just like they have push gifts, you also can, if you can afford it, or maybe consider doing a crowdfunding or a gift to a mom. Send her away for a week, even just like a weekend getaway or something, so she can just be in a space of newness and renewal. Or another thing that I encourage is sort of on the lines of creating sacred space. You can do that physically. There's so much attention, as was mentioned, to the baby. Oh, let's get the crib, let's get this, let's get the outfit, let's get this ready. And then what does mom have? Mom should also have a couple of outfits to look forward to changing into. Small things seem minute, but they're huge. Sometimes mothers walk around in just t-shirts because they just don't feel like, I don't feel like getting dressed. But those small things build up into their self-worth, into them wanting to return into the world, into how important and necessary they are. So, a deaf doula may pour into them in that way, so that they're thinking about life. Because when there's something that's separated from you and then gone, you also, just in the same way where partners may go right after the other, she may be thinking suicidal thoughts. She may be thinking those very same thoughts as well. So that's essentially what that person is there to do, is to hold space, uplift them, encourage them, and give them ideas for how they can acknowledge where they are, but also work towards renewal. So I just want to plug that, talking about advocacy, maybe consider that as a gift for a mom, or suggesting that as a gift, or a crowdfunding effort to either have centers or spaces or something that mothers can retreat to for a few days as well.
Thank you. And I know we are running a little bit over time, but I do want to close out and wrap up and give each of the panelists an opportunity to tell us what is your one golden nugget you want to share with the audience about maternal health, about being a doula, about being a midwife. And, you know, some of the things that I'm definitely hearing from the conversation is that this is your passion, this is your calling, this is your gift, making sure that you are, you know, pouring into yourself. And, you know, we talked a lot about language tonight and advocacy and empowering mothers to help them, you know, find their voice and then use their voice, and really building community as well. So before we begin to close out, I want to do a round robin or rapid fire just to get some closing thoughts. But before we get to that, I want to remind everyone, I know there was a couple questions in the chat. If you need a certificate of attendance, I'll drop the link to the evaluation in the chat. If you fill that out, then you can get a certificate of attendance that way. And let's start with Kayla.
With me?
Yeah.
Oh my goodness.
I would say one word, but I think that's too much of a challenge.
It's a bit of a challenge. I would just say this work is absolutely necessary. You bring so much value just by being here and being of an inquiring mind to become a doula, a birth worker, and a birth support. Don't ever let anyone belittle or make small of these efforts. And just remember that there is work to be done and you are the person to do it. You don't have to be bold and mighty to be radical. There are ways to do it gently and effectively just the same, but just keep going, persist.
Thank you. Lauren?
Yeah, so when we talk about midwifery, it really comes from this idea. It just means to be with women. So just being and supporting them throughout their reproductive health journey, whether that's desiring children, not desiring children. But really, when we do talk about maternal health, just remembering, this two-part of it of how do we get them better prepared? How do we make them feel empowered? But also how do we, from a provider standpoint, talk to our fellow colleagues, talk to our fellow, providers that we're working with, work within our healthcare systems so that the women aren't having to do all the work. We need to have less resistance from our healthcare system while also empowering our patients, our women, our clients to also be able to get into that healthcare system. And it's worth it. It's amazing. It's tough, but all the work is so worth it.
And William?
Yeah, just a few quick things. As I always say, birth work is family work. It's everybody's responsibility to make sure that our women and children come out of the birth process happy and healthy. Also, it takes a village to raise a child, as they always say. So you are part of somebody's village. You are a part of somebody's village, so it is also your responsibility to look after our birthing families and our birthing mothers out there.
Mm-hmm. Definitely. And last but not least, Pansy?
I would say for us to remember our lineages and our legacies of the granny midwives and the major and impactful part that we play in our birthing practices and experiences, always honoring that these are sacred rites of passage, right? That pregnancy, birth, and postpartum is a spiritual, emotional experience that should not be separated. And when you nurture and nourish the spirit, the mind, the body, and the heart through pregnancy, birth, and postpartum, you're almost guaranteed a better birth experience.
Thank you. Well, I am truly grateful for each of you for joining us tonight, and shout out and a special thanks to our panelists for sharing your wisdom and your guidance and your advice. I truly, truly appreciate it. I hope everyone was able to gain something from this webinar tonight. The recording will be made available hopefully by the end of the week. Also, I heard in the chat that there was some issues getting into the evaluation form. We'll fix that right after the webinar concludes. But again, I want to thank you all for joining us tonight and creating a space where we can learn and grow from each other. And I hope you have a great rest of your evening. And again, thank you to each of the panelists. And I'm excited to see where this journey takes us all. So thank you.